Hi, I'm Alex Metricardi, Chief Marketing and Public Relations Officer for Living Branches. Today is Friday, December 3rd, and I am back with Ed Brubaker, our Living Branches President and CEO, for a very special edition of our coronavirus questions.
Yes, it's amazing. December the 3rd, 2021, who would have guessed we would still be talking about COVID? But we are, and so it's the reality of our life, and so we need to do it. And again, I just want to reflect too that it has been a hard year and a half, going on 2 years soon. But I just really applaud the perseverance of our staff, of our residents, of our volunteers, of our board, families. It's been a very hard year, but the people have been amazing. I mean, it doesn't take long to read the news about airplanes and other behaviors of human beings in the US and elsewhere. And, overall, yes, we've had some emotional times and heightened emotions around here, but that's to be expected. But overall, people have just been amazing. And I'm really thankful for that.
This is our 50th episode of our coronavirus Q&A. And when I started thinking about the fact that this was coming up a couple of months ago, I was thinking, well, perhaps we'd be at the point where we could have more of a celebratory edition, and I could get balloons or party streamers or something like that. But that would not be appropriate for this episode. We are right back in the thick of it with COVID. Let me just quickly run through the numbers on where we are. At Souderton right now in personal care, we have 16 residents who are testing positive and 5 staff members at Souderton. At Dock Woods, we have 7 staff members who are testing positive. And at the Willows, we have 1 resident testing positive, and just a few hours ago, now one staff person at Willows testing positive. So all campuses seem to be experiencing COVID again with a vengeance.
Yeah, that's right. And I think it's easy also to assume that staff, and that's maybe from before, early in the pandemic, that staff was bringing it in, particularly when we were kind of more in lockdown mode. But now there's so many people coming in and out of our campuses. I mean, we don't have the public coming into our cafes and our gift shops and things like that, but we have fairly free access to visitors and families, as it should be, I think. But the risk of that then is we know for a fact that there are exposures and we know of them. And so when we had the more significant outbreak at personal care at Souderton over the past week and a half, early on, there may have been 1 person, there's more now, but probably not related to the outbreak, but 1 staff person who tested positive. And so, but there were 17 residents. And so the reality is likely it came in through a family member, it came in through going out of the community. We're living life, right? And so the reality of life is that you expose yourself to things. And so that's what happens. But I think the positive is that we are seeing that the vaccine and the boosters were maybe not, put in people early enough to get them, protection on this round, just because of the time that they were given. But we do feel that that's an important piece of it, because we do see that the symptoms are lessened. And we can manage the disease much better when we have vaccinated staff and vaccinated residents. Yeah. So within our population, we definitely continue to see the benefits of vaccination.
And you just indicated there and said that we had 17 residents test positive at Souderton, and I said 16. And the reason for that is that for the first time in 2021, we did have a resident pass away.
Yeah, that's right. And when you think about that, that is a significant period of time that we did not have any deaths from COVID. And we were very fortunate, and we're very pleased with that. But our condolences certainly go out to the family in this situation. And again, we won't get into the reasons and whys and wherefores as to why they chose not to be, but the bottom line is they were not. Now, all the people who tested positive were given the monoclonal antibody treatment, including the unvaccinated resident. And, we don't know how much that helped because we don't kind of have a test group, a control group of persons that didn't get it. But we do feel that along with the vaccine certainly helped. And unfortunately, it did not help in the resident who was not vaccinated. We also gave it prophylactically to another 2 persons who were vaccinated but had been exposed. To date, they are not positive. Again, we can't draw a conclusion that it had to do with the monoclonal antibody, but certainly we feel good about the ability to be able to have that at our disposal to provide the monoclonal antibodies to our residents. And the positive of that is we have a pharmacy that has a relationship that we have a relationship with through some connections that Monique Cole had made through the state. And they're very responsive, very responsive. In fact, I think they gave, Monique had indicated, same-day service on the day after Thanksgiving. Now, they probably had all their shopping done already, since you do that online now, right? You don't go to the store on Black Friday. I'm obviously being facetious, but the point is, they were very responsive, and we appreciate that very much.
Well, and I feel like, at least in the wider public, we don't spend a lot of time hearing about monoclonal antibodies. But we certainly have been giving them to anybody who's tested positive who wants them. And anyone, like you said, in this case, who's been exposed. And I believe in these cases, those were perhaps household exposures, or a little bit, we knew they had been exposed for an extended period of time. But it does, we don't hear a lot about it from the public, but it certainly does seem to make a difference for persons who are exposed or who test positive. So it may be something for us to tell our viewers that if you are exposed, or if you do test positive for COVID, ask your doctor about monoclonal antibodies, and do it quickly, because you got to get them early.
Yeah, that's right. It has to be done early in the testing cycle, like when you have determined that you are positive. I think the protocols would be such too that in certain situations, perhaps age of person, other health conditions, they may not be advisable, because in certain people who are vaccinated too, the level of severity of the illness is not as great. So the physician would definitely make that decision on that. But certainly among the population that we serve, it certainly has been something that we actually got started with, and I think it was last December, through a special program that had been funded through Penn Medicine. That program now has expired, and so they're no longer available to serve us, but we do have another contact that's been helpful.
And I think maybe touching on this same question, or this same idea about people being exposed at Souderton and just how many cases we have testing positive right now. We have seen a change in guidance from CMS, and therefore from the state of Pennsylvania, with regard to what happens when people test positive. And the change that we've seen in some ways, I think, is the result of the last year and a half of one positive test and them saying, let's shut everything down. No visitors, no dining, no activities, everybody stay in your room. So I think they were listening to a lot of public opinion about how detrimental that is to the emotional health, to say nothing of the physical health of our residents. And they've gone to the other side now, basically.
Mm-hmm. Yeah, and I think if I recall correctly, we even had a state senator in Pennsylvania from the local area who had introduced, and I think the bill was passed, if I recall correctly, that prevented the state from going into the kind of shutdown that would prevent visitors from coming to facilities like this. And while I understand the sentiment, it is interesting that it feels like sometimes providers, the health providers, are are not given as much opportunity to make their own professional judgment. And I understand why that needs to happen in certain situations. But yeah, it does feel like it's going the other direction, because we would regularly pre-COVID close facilities to visitors for coronavirus. I'm sorry, not coronavirus, for another virus, norovirus, and also for the flu. Now, the reality is with norovirus, it can go through pretty quickly and be done. And so both of those cases, no way, no how were we ever closed down for a year or 18 months. So yes, I think there are differentiators. And I think part of it too is it potentially too is to prevent operators, because we tend to forget all the different kinds of scrupulous or unscrupulous operators that are out there, but to prevent some operators from having an excuse to say we're closing down kind of ad infinitum and not allowing families to come in. And so, you know, it's trying to find the balance there, but it definitely is different. And I would say it creates anxiety for our staff and perhaps for our residents as well, but for our staff, because we've been so used to doing it a certain way, and now we do it in another way.
Yep.
The positive is that it is important, and we have seen it to be important, that the mental health and well-being, the emotional well-being of our residents is very important. And so that's a critical factor as well. Our daughter is doing her music therapy internship, and she obviously doesn't tell us details, name, rank, and serial number, but you know, she works in a hospital in Philadelphia as part of her internship, and it's in the a lot of times she'll be in the psych area. And there was a young person who had a child who, I don't know if they were in a COVID hotel or where, but they were isolated and they really had a psychotic break. And you know, when people are isolated, you think about being in one room. Wow, it gave me a new perspective on what some of our residents had to deal with this past year, and again made me marvel at the resilience that they exhibited.
Yeah. And I think I've at least had a couple of emails from family members who are saying, can you please clarify what's going on now as far as rules and guidance,
Right.
And can we visit, can we not visit? Because it all has changed.
Yeah, that's right.
So yeah, it really all has changed.
Yeah, and that's exactly right. And we are trying to make sense of it, doing the best we can to do that. And I would say I'd ask for patience of people as we're working through it, and we do the best we can. And first and foremost, we want to be focused on those we serve, keeping them safe, but also making sure that that safety keeps in mind their emotional health and well-being too. So it's multifaceted.
Yeah, definitely. The other, I guess, big item that we've all been working on, in addition to understanding all of the new rules for the past couple of weeks, is the vaccine mandates that we're approaching on December 6th. So perhaps we should talk a little bit about that.
Yeah, I joked with somebody the other day that I needed to go to my chiropractor, and I shouldn't even say my chiropractor because I don't have one. My wife says I should go to one, but I haven't recently. I have already, but I joke that I should have gone to my chiropractor for the whiplash last year, because that's what it feels like. You know, we're on again and we're preparing. I joked, I wonder what it costs across the industry in the last 2 weeks, 2 months to prepare for this, and what resources were expended now only to be driven to a screeching halt. With that said, though, we are continuing to move in the direction because we believe at some point it's going to be part of the requirements. We feel it's not terribly onerous now that we've forged this path. Our staff can either get vaccinated, and quite a number have done that. We had persons applying for and receiving religious or exemptions. And we did not have any medical exemptions that were applied for. And we had, I think it was only about 5 or so, and many of them part-time persons who chose to leave the organization. So we were down to just a very few people that we needed to understand what their decisions were. And so we let our staff know via a mass email that, yes, this stay has been put on. We don't know what that means in the long term. We don't know how long it's going to be, but we want to be prepared, and we're continuing just to move down in that direction. I think it's the best direction to go in, and we're almost there anyway. And it's been helpful to get some people vaccinated, to clarify for others, and I think we're at a good spot.
A couple things that have happened as a part of this that have been of interest to me. One is, I guess I feel like, okay, government, if you're going to do this stuff, could you please do it in a more timely fashion? Our staff spent, I mean, we were already 85% vaccinated. So the persons who were not vaccinated had to spend in some cases, not insignificant time really wrestling with, what do I want to do? And so we've had a fair number invest their time in putting in an exemption, like you said, a religious exemption. We had also a very fair number say, I'm going to make it, I've made the decision, I'm going to go get vaccinated. And in fact, we are doing one more vaccine clinic today as we speak. And I know we had multiple people going to get their first vaccine at that clinic. So they've made the decision, they're carrying through with it. I had received several emails from resident family members who were very concerned that the mandate would mean that their loved ones, caregivers, would be quitting. And I'm so pleased that that appears not to have happened at all.
Yeah, that's right. And it is a complicated situation. And I think since the beginning of the time when vaccines were available, I've been pretty clear, for me personally and as CEO of Living Branches, that I believe the vaccine is maybe not the silver bullet, but it is a key part of the way that we get to the other side of this. And I believe strongly, based on the evidence, that it's made a big difference. And I would encourage everyone to get the vaccine. Having said that, I also want to try to be respectful of those who have differing opinions from me. I will absolutely still try to convince and show why it is a good thing. And I don't deny that, and I have no problem with that, because I think all of us can continue to learn and grow and learn new things. If it's, based on politics or anything else, I'll be honest with you, I'm not sure that makes sense when it's a scientific issue. But at the end of the day, we have differing opinions. And I know at least one situation where of a staff person who appreciated that we were being respectful and having the opportunity to review a religious exemption, et cetera. So at the end of the day, we want to try to show ways that we can be respectful of each other, because that seems to be at a pretty low point in our society right now. With that said, I still believe that the vaccine and boosters are really an important part of us in a retirement community, keeping ourselves safe, keeping our residents safe, et cetera. And, I'll continue to say that, but I want to be respectful of others as well.
It's nice if you're on campus right now to see that it looks like the holidays. Christmas decorating is taking place. The trees are going up, the decorations are coming out. So I guess as we close, I should say, Merry Christmas, a little bit early to you. It's been yet again another type of year that I didn't think I was ever going to live through, but here we are. But it's nice, I guess, to see it coming to close and looking a little bit more like a traditional holiday season on our campuses.
Yeah, that's right. It definitely feels different than it did last year. Yeah. It is still different than I would like to hope that it can be again in the future, but it certainly is different this year. And I know maybe it's a bit cliche, but it's also, I think, true, when people talk about love coming down at Christmas and that kind of thing, and kind of the birth of the Christ child. and what that represents. But I think that really is, again, what we want to focus in on, our love for each other, our love for our residents, our love for our staff, our families, and really to continue to show that during this season and throughout the year, to be respectful, to be open and honest, and to show love and care to those around us, those more fortunate than us, and also those less fortunate, that we really show the love of God to other persons. And so that would be my wish and my hope for all of us during this season and the coming year as well, that we continue to find ways to build bridges instead of burning bridges in our organization and our country as well. So yes, Merry Christmas to all, and to all good night, as they say.
Well, thank you. Thank you to our viewers. As always, if you have questions, please send them. You can email them to me at coronavirusquestions@livingbranches.org. I'll be happy to answer them. Have a wonderful holiday season, and we will see you in a little while. Thank you.